Under the bill, as it stands at the moment, a lot of organisations will have responsibility for talking to the public. You're going to have the new National Commissioning Body. You're going to have Monitor, which is going to regulate our hospitals and other secondary carers. But at local level, not only have you got the clinical commissioning groups, but you're going to have Health Watch, which is going to take over many of the responsibilities that are currently undertaken by links. But above all, we're going to have far more significant roles played by our local councils. There will be a local health and well-being board, and local councillors will expect to exert far more influence than they have up to now upon the design and the delivery of our health services. There are huge areas of uncertainty about the detail of the government's proposals. But whatever happens, we do know one thing, and that is that clinicians and the people working with clinicians are going to have a pivotal role in determining what happens to local health services. They are going to be commissioning, and it is only fair that they realise now how much public engagement and involvement will be necessary when they take over this important set of responsibilities. I think most doctors know already, because they already have a range of activities that they're undertaking to do with gauging the views of their patients and of the public at large. But this will become far more intense when there's no primary care trust to do it for them. It'll also bring them so much closer to the hundreds of patient groups and representative bodies that you have at Birmingham who have an interest in particular conditions or in a particular locality, particular community problems. And that'll make a big difference. I think the main consequence for clinicians will be knowing who to talk to, when, and about what. And if that sounds a simple equation, it's not really, because there are literally hundreds of groups there who want to talk to the NHS. And up to now, there have been structures such as primary care trusts and strategic health authorities that have undertaken a lot of this consultation workload from them. Well, from now on, the buck will stop with doctors and other clinicians, and what we need to do in the forthcoming training program, which we've been proud to assist with in Birmingham, is to help these clinicians find out exactly when they should have these dialogues and how they should undertake them.